So I want to thank everyone for coming tonight to take part in our Health Innovation Pitch Competition Information Night. The Health Innovation Pitch Competition is actually sponsored by the Nova Scotia Health Authority, Innovacor, Cape Breton University, and the Island Sandbox. I want to give special thanks to Innovacor and Nova Scotia Health Authority for helping finance this project and award the prizes to our winners. So the question is, do you have a business idea that will improve health outcomes? This is your opportunity to bring your business idea forward for a chance to win $5,000 and also receive the benefit of business mentorship from the Island Sandbox from Cape Breton University. Now, we'd like to foster innovation in Cape Breton Unama'ki, and we know that there's startups and potential startups out there that have innovative ideas. So this is their chance to step forward. When I talk about innovation or health innovation, I just want to qualify that a little bit. You know, what can it be? Well, the solution, the health innovation solution, could be a device. It could be physically something you built. It could be a software. It could be a process. It could be a lot of things that it could be. And to sort of illustrate, in some cases, how simple innovation can be in healthcare, I'm going to actually go back in time a little bit to look at the Crimean War in 1853. Now, this is a picture of the hospital in Scutari, Istanbul. This is the British hospital. And at the time, 1855, 1 in 10 soldiers actually died from infection, died from dysentery and cholera. Disease simply tore its way through the British Army. Now, germ theory didn't exist in 1850. They just didn't know germs existed. And it wasn't a problem just for the Army, but it was a public health disaster in general. Doctors at the time basically said diseases are unavoidable, deal with it. It got so bad that in March of 1855, the British government sent in a sanitary commission. What they found was appalling. The drains were blocked, the hospital sat on effectively a cesspool, and even the main water supply was blocked by the body of a decomposing horse. Now, in the middle of this, you may recognize this historic figure, Florence Nightingale. She's known as the Lady with the Lamp. She's known as the hand-washing queen, and she understood that cleanliness saved lives. So when she returned to England, she got the ear of the Queen, and she persuaded the Queen to launch a royal commission to find out why was the death toll so high in the Army. Now, you may know her as a nurse, but Florence Nightingale was also the first female member of the Royal Statistical Society. And she was what we would call today a master of data visualization. If she was in the modern era, she would be a programmer writing an app, but she understood the technology of her time. Now, with the data, she understood the premature death was linked to open sewers and bad ventilation, basically unclean conditions. And she also knew that the solutions were relatively simple: flush sewers, clean surfaces, paint surfaces, keep things more hygienic. But at the time, she was a woman in a man's world, and the Army did not want to listen to her. But she did have the ear of the Queen, and that was obviously important. Her technical breakthrough is actually a diagram. This is actually one of the most effective, diagrams that has ever been designed, ever been written. It's called the Rose diagram, and I'll unpack it a little bit. On the right-hand side, we have the large rose. We have the large circular structure there. And if you look at it, the red area represents how many deaths happened per month due to the war itself, due to casualties in the war. The black area was due to other causes, and the blue area in the diagram was death due to infection and disease. Now you can see that the deaths due to infection and disease far eclipse even the casualties from the war itself. And you can also see that in March of 1855, when the Sanitary Commission showed up, conditions start to improve, and the number of deaths that drop due to infection, or the number of deaths due to infection, drop precipitously. So this is an example of using data and using information and creative innovation in order to move a world. And this diagram effectively has helped save billions of lives by an understanding that infection leads to death. So with that kind of innovation in mind, I'd like to welcome everyone that's taking part in the student pitch event. So the entry deadline is December 6th. You can visit online, cbu.ca/student pitch event. And we're also going to be including, leading up to the actual pitch on January 28th, we're going to have 3 training sessions on the 5th, 9th, and 11th. Of course, we have a $5,000 prize. The pitch competition will take place at the Pit Lounge. We'll have 4 to 6 people in the judging panel, drawn from representatives of the community and industry. And we're hoping to expect to receive individuals and team entries. They'll be allowed a 5-minute pitch presentation, and judges will be allowed 1 question each and 1 follow-up question. So the schedule for the day, we'll have an official start and breakfast at 10 o'clock with welcoming remarks by President Dingwall. Pitches will begin at 11 o'clock, and by 12 o'clock, the judges will have had a chance to hear the pitches, deliberate, and announce the winner. We'll follow up the afternoon or follow up the morning by a lunch and a networking event. So the presentation training is 3 different nights. The first night, January 5th, we're going to talk about business presentations from design to story, and we're going to cover topics like what makes impactful slides and how to become a masterful storyteller. The second night, on the 9th, is building your business case. Here's where we learn the business fundamentals and we talk about the metrics and deliverables that will impress investors and judges. And the final night, we'll be doing individual pitch practice. So the participants will be able to get real-time feedback to polish their presentation and make their best pitch. So with all of that, I want to welcome you or thank you for coming this evening. If you have any questions, please email us at healthandwellness@cbu.ca, or you can drop by the Island Sandbox located in CC 144 across from the CBU campus bookstore. Thank you.